Hey everyone. A big question we tend to get all the time is exercise safe for somebody with knee arthritis? And is something as simple as just walking effective for them? And I wanted to show two studies here that you can see in the blog below. One I'm looking at, how many minutes should you walk a week if you have severe arthritis? A lot of times when you have a lot of pain and stuff, you don't want to move, but we know that movement's medicine and we can get it better. And especially if you're trying to prolong or avoid any type of knee replacement or injections or surgery. But interesting enough, the authors found in this one study that 70 minutes was a good cutoff score or a cutoff time for amount of exercise of walking a week. So that could be 10 minutes a day or preferably, potentially 20 minutes, about three and a half days a week. So the interesting thing, once somebody get up to 95 minutes, that's when a lot of the adverse events come in. So we want exercise to be beneficial, but we don't want it to be adverse eventful for you to create more pain. And so this kind of brings us to another study that was recently performed, and actually it was a 6-week study looking at people who have knee arthritis if they walk backwards and how that responded versus another group of walking forwards. And actually, they found that the group that walked backwards is actually had a less pain and improvements in the functional limitations that are associated with knee arthritis. So potentially what we're getting to here is that we know exercise is good for you. We know that maybe repetitive movement just in the frontal plane or just moving forward walking, there's a limitation to that. You might be limited to 70 minutes if you look into some of the research. Now, this is severe arthritis compared to maybe mild or moderate. But if you reverse it a little bit and you go backwards, actually that might improve some of your pain. So ultimately, we want to get off is from this post here is that exercise is good, movement's medicine. We don't want you to move too much if you're having a lot of trouble. You might need a graded tier approach, especially if you're having pain or some sort of pathology. But also we could fill in the gaps, as we always like to talk about it. So if you go from just sitting to walking, well, we might to do something in the middle of getting your muscles to work a little bit more effectively, maybe a little bit of love, as we like to say, to the knee, and making sure that your quadriceps are firing correctly, and even your hamstrings, your range of motion, your ankle, and your hips. So if you have any concerns or want to reach out to us, feel free to comment below, and hopefully we can help you with some interventions if we need to for your knees. Take care.